it's Dr. Ruan. I'm sitting here with Dr. Ankur Mehta, and he is an interventional pain doc here in Houston. And we want to talk about regenerative medicine. So what do you think is regenerative medicine?
So regenerative medicine is essentially utilizing the body's innate ability to heal itself and essentially augmenting it and giving it a boost so that the body's able to regenerate tissue the way it did when it was 15, 16, 18 years of age.
So it's crazy because we think aging as a degenerative process, like things just start getting worse. Right. And we don't think there's necessarily a way to reverse some of it. But I guess there is, right?
Absolutely. And that's one of the I guess the frontier of the 2000s is that we've uncovered ways in which to kickstart the body's regenerative process so that it can mimic the youthfulness of regenerating everything from cartilage to tendons to, in even certain cases in some research, cardiac tissue.
And well, so what's the technique? Like, what do you do?
So there's a bunch of different options out there. Two of the main ones that I utilize in my practice are PRP, which is platelet-rich plasma. Essentially, draw the blood out. I concentrate it to 10 times the natural concentration and take all these growth factors and inject them into soft tissue injuries like tendonitis or rotator cuff tears, meniscus injuries, things like that, to help the body to kickstart a healing mechanism. Another option is bone marrow aspirate, which is kind of a combination of both growth factors as well as true live stem cells from your own body with your own genetic material, with your own God-given tissue. We concentrate those down, we separate them out, and we inject them into the site of injury, from everything from the spine all the way to the knees, shoulders, any part of the body that needs regeneration.
So you use this fancy device back here, right, to do so.
Yeah, that's right.
So this is a C-arm, for you guys who don't know. And it's kind of like an x-ray, and it guides where things go. And so what's interesting is our body's bone marrow contains these things called stem cells. And stem cells are cells that are able to differentiate or turn into other cells, or they actually have factors within them that allow the other cells to heal and differentiate as well. And so that's really the trick behind trying to basically reverse the aging process on different body parts, right?
Absolutely. You know, it's really interesting. There's a term, I'm sure you've heard of it. It's called the paracrine effect. Essentially, when you introduce a cell into an environment, it's like if you imagine if you're at like a cocktail party and then that one couple or that one guy walks in and all of a sudden the room's energy changes and people get more lively and excited and you know the party's here. And that's a very similar thing that you can mimic or you can use as an analogy for the paracrine effect, where you inject a happy, young, live cell into the mix, and these old cells around it and this defective tissue all of a sudden starts to heal. And it's been proven time and time again in many different research models, animal as well as in vitro and in vivo.
Yeah, so essentially what we're trying to do is to, instead of, covering up symptoms with medications and other sorts like steroid injections and stuff like that, which can potentially deteriorate the tissue.
Exactly.
We're really trying to regenerate the actual tissue. So anything from, I think joint arthritis,
right, and
even looking at tendons and helping repair
That's
tendons. Right. Now, the biggest thing in my practice is try to prevent from people going into surgery or unnecessary medicines for a long time because they have dire side effects. And so that's why I'm really, really big proponent of regenerative medicine. I don't do regenerative medicine, Dr. Mehta does. But one thing that people always ask is how many times do you have to do this? Do you have to do this lifelong? Does it depend on the injury, or does it depend on what does it depend on?
So and to answer this question, I think I can give you a couple case studies. How about that?
Mm-hmm.
Just to give you real life patient examples. So I had a 80-year-old tennis player. I saw her about 4 years ago and injected her shoulder. I just saw her last summer, and she's doing fantastic still. So it's been 4 years. Mm-hmm. And then there are situations where patients have had multiple car accidents or multiple surgeries. Well, they'll need repeat treatments. But the beauty of PRP and bone marrow is it's your own DNA, it's your own cells, it's your own tissue, it's your God-given cellular matter from your body that we're just concentrating and putting it right back in. And at this point in time, as of Christmas of 2018, the FDA has said that this is completely fair, and they're completely okay with doctors doing these types of treatments.
Okay, yeah, wonderful. And so the other question is, some people have pretty, I'll call it toxic lifestyles, whether they smoke, they eat poorly and stuff like that. And in my experience, that contributes to joint degeneration,
Absolutely,
tissue regeneration,
totally.
right? And so in those type of people, are they still able to regenerate with these procedures?
Absolutely. So one of the biggest things that I've come across is that I usually partner up with a provider like Dr. Cheng, Dr. Ruan, and we essentially optimize the body, because anytime that you're for example, let's go back to the cocktail party scenario.
Sure.
So you want to make sure that you're shaven, your suit is pressed, your shirt's clean, and you want to optimize yourself before you get into an environment. And this very similar thing with regenerative medicine is you want to optimize the body, you want to detox, you want to chelate, you want to optimize all your supplements, and whether it be going through detox sauna, or taking supplements, or quitting smoking, or doing some acupuncture. There's so many different variety of treatments that we can do that in a complementary approach that can maximize the patient's benefit from regenerative medicine.
So lifestyle promotes regeneration.
That's right.
It's really not just about the procedure. There's a whole thing that needs to be done, right?
That's right.
It's a process, and it is a combination of different things, because we know that there's particular diets and there's even fasting that's able to actually increase circulating stem cells.
That's right.
There's hemp and CBD oil that's able to increase circulating stem cells. There's all sorts of different things that are out there, but the best approach is to really combine the two.
That's right. Yeah.
And so I've run across a lot of like military veterans who has been through some really tough times, degeneration and even neurodegeneration in the brain.
Brain injuries and things like that.
Yeah, brain injuries, shell shock. They have cervical spine issues after they've been in the military. Do you see some of these people?
Absolutely. So I worked in the VA for about 4 years.
Oh, okay.
And so I dealt with a lot of OIF, OEF veterans, and we worked very, very closely. And you're absolutely right. Nowadays, it's actually kind of an interesting concept, but the armor is so effective that normally people that would have passed away from an injury are now surviving it.
Oh,
and
yeah.
so they're having a lot. We're seeing a whole new spectrum of brain injuries and spinal cord injuries and amputees that those soldiers would never have made it if it weren't for all the new technologies that now they're having in the armor. So yeah, absolutely, and that population is on the rise.
Oh, that's interesting. I never even thought about that. That's kind of cool. And people are also living longer.
That's right.
Right.
That's right.
People are living longer. We see, we see a lot of like Olympic athletes and the professional athletes in that realm who have been through. They've used their joints a lot. Gymnasts have used their joints quite a bit, right?
Really.
But even they cannot, avoid the aging process when it comes to the joints. And so, on the sports side, let's talk about the sports side. How can regenerative medicine help with the athletes?
So that's a great question. Couple quick points, quick concepts. One is acute injury versus chronic injury.
Mm-hmm.
After 6 weeks, the cells kind of get bored and they go away. The healing crews go away from the injury.
Okay.
So after about 6 weeks, it's turned into a chronic injury. And the studies have shown when they do biopsies, when they do tissue sampling, that the regenerative stem cell concentration drops off a cliff at the 6 week point. And the likelihood of the athlete returning to the pre-functional level or pre-injury level is very low. So it's kind of like the 6 week point. Usually most young guys, most young gals, they're really fit and
Right.
active. They'll come and see you. You'll give them a little bit of topicals and things like that. Maybe some supplement, optimize their health, get them to get their collagen and things like that. Well, after that 6 week point, if it's not healed, it's turned into a chronic injury.
Mm-hmm.
And that's where getting the growth factors out, getting the bone marrow out, and putting it in the injury, it kind of kickstarts the party, and then it really, really stimulates a healing response.
Okay, so some of these people have injuries for decades, and then they just get worse.
Right,
But
absolutely.
you see them improve.
I do, absolutely, 100%. And that's one of the things that, I even use an example of my own father, where I injected stem cells in his back, and he had this chronic spine injury for almost 6 to 7 years now. He's tried everything, seen 4 surgeons, done all kinds of investigational treatments and research, and I did a bone marrow stem cell, and it was the first time when he says that he's able to get out of bed without cringing.
Wow, that's amazing. That's amazing. Well, sounds good. That's just a quick intro to regenerative medicine. We'll be doing the videos on a whole lot of different topics. And so make sure that you leave some comments below if you have any questions, and hopefully we'll get back to you. Thanks a lot.
Right.